Okay. Good morning, everyone. Welcome to another edition of 1 Million Cups. My name is Nicholas Stamper, and I will be hosting today's presentation. First, I'm going to talk for a few minutes about 1 Million Cups Chico, its actual mission, and the second thing will be the actual 6-minute presentation given to us by our special guest. Third will be a Q&A for our audience, and then finally after that, we will wrap on up. 1 Million Cups was created by the Kauffman Foundation. The purpose of this foundation works alongside educators, researchers, and other partners to better understand and improve an environment in which entrepreneurs start and grow businesses. 1 Million Cups is a free weekly program to not only lower the barrier of access to education resources for all entrepreneurs, but to be surrounded by a community and an environment that helps you get better ideas and get feedback for your business. In the beginning, 1 Million Cups started off small in Kansas City, but now has grown to 131 communities. Moving forward at each location, there are presentations each week. Today, our presenter is Sarah Amili with ELAK Health. She'll have 6 minutes to present and then 15 to 20 minutes of Q&A. If you want to know more about 1 Million Cups or how to present here, please feel free to join our amazing community online and visit our platform at www.1millioncups.com/Chico. And from here, I'm going to let Dr. Amili take it. All right, whenever you're ready.
All right, thank you. Do I have permission to share my screen?
Absolutely.
Thank you. All right, thanks.
There we go.
Lovely.
Are you seeing my screen? Okay.
Yay.
All right, first step check, technical check. Okay. Thank you so much for having me here. Again, I'm Dr. Emily. I'm an advanced clinical pharmacist provider. I am the founder and the CEO of ELAK Health. Today, I'm going to take you on a journey of what ELAK is, what the problem is, what ELAK is solving, and how you can all benefit from that, and what help we need at the end of the presentation. So first things first, let's start with the problem in the healthcare system. Right here, as you see, this is my family. If you recognize me, I am the second person on the left. And all the way to the right is my dad. My dad has had healthcare insurance for, his whole entire life in this country. However, every time he wanted a physician appointment, he had to wait for about 6 weeks to get an appointment. And when he would get that appointment, he had to wait, or he would go in, wait for an hour, only to see the doctor for 10 minutes. After the 10 minutes, my dad would get out. At the time, I wasn't a doctor, and he would have all the kinds of questions, and I didn't know how to answer them. Just like most families, yourselves included, probably. So with that said, every time my dad needed something, even if as simple as a refill, medication refill, because he has a history of hypertension, which is high blood pressure, and a history of diabetes and cholesterol. So as you imagine, these are chronic conditions where medications are very crucial. My dad had to go to the emergency department multiple times for things that could have been prevented. He didn't need to go to the ED for a medication refill. He didn't need to go to the ED because his blood sugar was high. He didn't need to go to the ED because his blood pressure was high. But yet he did. And every time he did, he had to wait, and I'm sure some of you have experienced this, for 3 to 4 and 5 hours for someone to eventually see him. And then when he gets seen, they say everything is fine. And what's the last thing they tell you out of the ED? Follow up with your primary care physician, which he would have had they had the time and accessibility and the resources. Fast forward 3 years ago, my dad had the same exact situation, but this time was different. He actually had symptoms that he was very concerned with. He didn't want me to worry. I asked him to go to the ED, and he said, no, you know what? Every time I go, they put me there for 4 or 5 hours. I'm just not going to go. I'm going to sleep it off. And I tried to tell him, Dad, if you have something that bothers you, please go. My dad refused to go to the ED because of all the previous experiences that he had in the ED. Eventually, he went the next day. Ended up that my dad had a stroke. So this is the story, and this is the problem. Our stroke patients are not making it to the ED because of all the patients that are in the ED that shouldn't be there. And that is why we have a healthcare crisis. So what is happening? What went wrong? If we were to dissect this, the heightened healthcare expectations, right? My dad has high expectations. Your families have high expectations. I sure hope you do, at least. because it is your health. It's the strongest thing that you have. It's the one thing that if it goes, it doesn't come back. Health is crucial. So the expectations plus now the chronic conditions. Every 1 in 5 people now have diabetes. When I went to school, which was more than a decade ago, believe me, it was 1 in 20 people, and now it's 1 in 10 people have diabetes. We've doubled, and we're still going to double and triple even more by 2030. Then what happens? We don't have staff. We have physicians that are leaving our facilities because of the extreme burnout, because of the suboptimal financial reimbursements. Burnout has reached all-time high, especially after COVID. So what's happening? We have the mass exodus. Physicians are not staying, and medical students are not going for primary care. They're going for dermatology and cosmetology and all other things. But what's happening to our patients? What's happening to you and to your families? You don't have healthcare access. By the time you want to see a physician, it takes about 4 weeks. By then, you're either okay or you have landed in the ED if it was severe enough. Or if it was a medication refill, you probably had to find some other alternative because you can't wait without a medication for 4 weeks. Then when you get there, like just like my dad, average length now is 15.7 minutes. That's in the country. In reality, it's 10 minutes. What happens? They diagnose, they let you to go to the pharmacy, and you say, the physician says, if you have any questions, ask the pharmacist. You go to the pharmacy, you stand in line for 30 minutes if you don't have mail order, and then you get a pharmacist that asks you a question for 30 seconds. What questions do you have for me? Well, you can't know what you don't know, so technically you don't have any questions because how would you know? So now you have knowledge deficit. What do? You go to Dr. Google and you go to your friends and your families and you learn about all the things that have happened to all your loved ones or all the things that are on the internet that tell you not to take something or take something differently or wrong. So what happens to you? You get worse. And then what do? We end up in the hospitals and the EDs again. Right here is what I mean by having a healthcare crisis. We have a huge imbalance between the supply and the demand. The supply of our physicians and our medical staff, and the demand of the increased chronic conditions, the demand of the healthcare expectations, the demand of the patients that are growing older and living longer. So if this doesn't paint a picture, let me help you complete the rest of the picture of how we can fix these puzzle pieces together. I have tried to explain all the gaps in the system, and then now we have ELAK Health. So ELAK Health was born, if you will, because of 2 major things on our end and 2 other things on the healthcare system's end. The first one is healthcare expertise. I and my partner, who's a CFO, and Dr. Rami Al-Mili, has been in the healthcare system for more than a decade. For myself, it's been exactly 15 years functioning as a practitioner, and for him, it's been more than 20 years. And then personal experiences. I was humbled to share a story about my dad, but believe me, the same story happened to my grandma, to his dad, and to a lot of other family members. What's happening on their end that made ELAK be created? It's a convoluted bureaucracy. I've worked in many healthcare systems. Some of them are the very large and highly esteemed ones. It's very complex inside. We've made it so complex that now we can't even change it. And to change it, it is so slow. By the time we actually make a change, we have a lot of lives as a cost. So we created ELAK, which in our language means for you. And we are Dr. Sarah Al-Mili and Dr. Rami Al-Mili, like I've shared. We're both pharmacist practitioners, different field of pharmacy. I'm a clinical advanced provider in the state of California. That means people, pharmacists of my kind, can do all things that a physician can do except diagnose. So we take care of everything: medications, education, tests, labs, discontinuation, everything a physician can do except diagnose. Rami is on the other side. He has all the business and customer service experience because he has been a long-term care pharmacist, compounding and outpatient pharmacist. So think of your senior facilities, think of your long-term care patients, think of your patients that have dementia, Alzheimer's. That's his expertise. So what did we do? We pretty much mapped it out, looked at where all the gaps are, and then we filled the gaps. So access. When it comes to our patients in ELAK, we actually see them for 1 to 2 hours. The first intake is 2 hours because it takes a lot to get to know what's really happening. And then all follow-ups from there are 1 hour each. Then we have weekly follow-ups, or less if the patient doesn't need a weekly follow-up, right? We tailor it to the patient. We work all hours of the day, all days of the week, because what is it or what benefit do we have if we have another healthcare system that also shuts down when the patient gets off of work? So then we're just leaving the problem the same. And that's why we open a lot of times after the patient gets out of their jobs. Doctor visit. We maximize the efficiency of this by something we call clinical patient advocacy. We actually go with the patient to the doctor. Can you imagine a situation where you're sitting there with the doctor and you actually have two doctors on the same call or visit? And I get to amplify your voice if I were to be the provider, the ELAK provider with you. And the physicians on the other side absolutely love it because they're like, oh, can you do this again? Can you do this for all my patients? And that's where we close all the gaps and the understandings. Pharmacy consultations, I mean, hopefully this is a no-brainer with both pharmacists, so you can skip the line and come to us. Medication adherence, this is what we do, right? Because compliance and medication adherence, let me give you some statistics here. 34% of Americans do not pick up their meds after hospital discharge. Let that sink in. 34% of Americans don't pick up their meds when they leave the hospital. So when we help with all these gaps, what do? We restore the healthcare system. We prevent hospitalizations, especially those that were preventable to begin with. And then obviously we're the providers at the patient's fingertips. So these are the things that we do for the patients. And just as a very quick summary, 60-minute appointments, streamlined medication therapy management. We reduce costs. I've seen so many different patients on thousands of dollars of medications. If you heard anything about big pharma, it's real. And we need to reduce these costs for the patients so that they can stay compliant. Education, lifestyle coaching, team and medication consolidation approach, i.e., if a patient has, most patients, right? They have a primary care physician, they have a nephrologist, they have a cardiologist, they also have a health educator, they have so many different providers. And almost 99% of my experience with every patient and all ELAK providers' experiences, those providers never agree. They don't even know what the other provider is doing. Cost-effective treatment, follow-ups, after hours and on the weekends, and then obviously attend the doctor's visits with the patients, like I've said. From a B2B standpoint, we're trying to target our patients through different entities as well to alleviate the pressure on those entities, and because public health education and engagement is really the #1 root way to make sure that our patients are educated and not in the hospital for preventable reasons. So we've been partnering with local communities. We've partnered with nonprofit organizations and independent pharmacies. And each of these entities have benefited in all different ways outside of patient care. And you can just imagine the magnitude with adding patient care on top of that. Next, we have the primary care practitioners that we are hoping to partner with in the future. And then our future goal is to have employer partnerships as well to take care of the employees of any facility or small businesses or even large ones to make sure that we prevent absenteeism and other things that they would be suffering from. Happy to share our partners here. Our partners have grown, but these are the ones that we have robust relationships with, whether they were our customers or our entities or our sponsors. And then lastly, I'm going to take you through 2 last examples of how ELAK has been saving lives. When we do public screenings and public health engagements, like I said, the #1 route, way to prevent diseases. When I saw a patient had blood sugar of 400. A 400 patient blood sugar, I don't know if you know anything about diabetes, but that's called DKA. That's diabetic ketoacidosis. That would have been a hospitalization had we not caught it right there in the moment. Patient didn't know that they have access to 1, education, 2, insulin, 3, a provider. So when we provided all these things, we literally saved life. And that life saved in diabetes right now, a hospitalization of diabetes patient is on average 3 to 4 days. And the cost of that per day is $24,000. So you can do the math there. The second part from a B2C standpoint and how we see our patients one-on-one is meet SB. SB had come to ELAK with a chief complaint of also diabetes. When we sat with SB, we thought, oh, okay, what's been happening? Can we give us the history and so forth? A physician would have put metformin or insulin or whatever they had, added to the patient's list and told her to pick up the medication and go home. When we sat down with the patient, we realized that the patient does not need any medications actually. It's that she has severe symptoms of PTSD. And when they flare up, she ends up having erratic lifestyle and diet. So we had to actually work on the PTSD and the diabetes fixed itself. Again, you can think about the impact, the preventable hospitalizations, and the cost saved. So with that said, I am done with ELAK's presentation, and I would love to share all the connections and the events. We're happy to be there. So thank you, Heather, for inviting us already in the beginning of this presentation. Please spread the word to patients about chronic conditions and how we are here to help. And lastly, we're looking for obviously sponsorships, to make sure that we reach all the patients possible, especially in the underserved communities where our hearts are at. And we'll take it from here. Happy to take any questions.
Wow, let's give a
Well
hand
done.
for ELAK Health, Dr. Sarah Miller. Amazing.
Thank you.
I kind of have a question. I mean, not
Yeah.
kind of. I do have a question. Like I have health insurance, but I don't have Medicaid, but I know a lot of people who are on Medicaid, and I've heard a lot of people's preconceptions of Medicaid, how it's just from like what people have told me, it's very like basic, bottom of the barrel, like you're barely accounted for, cared for, anything like that. Do you think that that's like a widespread belief in that kind of thing, or is it true? And is that something that kind of prevents a lot of people from really exploring health insurance?
So health insurance is a whole different
Yeah.
topic, but from what I can give you in terms of facts, is that every health insurance has tiers, right? There are tiers in everything. There's low tier or golden tier and bronze tier and whatever they call the tiers for different plans. Problem with these tiers is that if the cost of the hospitalization and the big pharma cost, right, like the cost of the drugs exceed the tier that you have signed up for, then you end up paying more, and that's why they say you're at the bottom of the barrel. There's a huge shift right now happening in our country where there's a lot of advocacy and political concerns to move health insurances to be or to offer to concierge services to really get the care. But obviously that's a big battle. I'm involved in it myself, and it's going to take a while.
Wow. Cool.
I could say something about Medicaid in Chico, having lived there and been on Medicaid. I was able, okay, I did out-of-pocket expense at a doctor across town, and they did not discover that I had diabetes, even though I had a medical checkup. I even had I had invasive procedures, the usual stuff that you're supposed to do. And then I was hospitalized for a growth on my neck, and it turned out that I was in like 300 something on my glucose, and so I had out of control diabetes. It wasn't quite up to the heated whatever you said. So now I'm on insulin and everything else, but Medicaid was pretty good at providing all that. So it took me a while to get into Ampla Health. He's my new primary care facility. So it's not horrible if you do it right. So
Yep.
Anyway.
Agreed.
When did you and your partner originally incept the idea? How long did it take from like your idea of ELAK to like the drawing board to where it's at now?
So I started having this idea when I started working as a practitioner in healthcare systems and organizations, and that was about I want to say 10 years ago as a full-on practitioner. And the more so my healthcare journey has been very blessed and also cursed. I had the blessing of going up the corporate ladders into the different systems, all the way to really, really high positions. And the higher I climbed up that ladder, the more I saw the gaps. And at some point, I felt like I was being part of the gaps, because when you get up there, there's healthcare business, and sometimes the business trumps healthcare. And so to answer your question, that idea started about 10 years ago, but really became robust in my mind 5 years ago. And I felt like, okay, it's time to fix that gap. Wow. And I'm not gonna lie, 3 years ago, we decided that it's time, because everyone around us is being impacted by what I'm seeing up there.
Yeah, especially 3 years ago with the outbreak and everything. Do you think that that has deterred or maybe like inspired more people to put more importance into healthcare and like and go into the doctor, their care providers, all the above?
When COVID was at all-time high, people with chronic conditions, because because of all, what they heard about the risk of chronic conditions and the impact of COVID on those patients at high risk, everyone wanted to take care of their health. Everyone. We had a huge surge of all kinds of patients wanting to be able to have a telehealth appointment to see their physician or to see really anyone to make sure that, for example, diabetes is in control so that they don't have COVID or they don't have it bad. The moment COVID subsided and we felt a bit of norm going on, everyone retracted again. So I'm like, okay, I'm good now.
Yeah.
So so it's a membership-based program.
For our B2C, in the B2C model, yes.
Okay, that's what I'm looking at. So is any of these fees, would they be covered by insurance or just by case basis? And how are you, what's the feedback as you are, I'm just thinking about companies taking this on for their employees.
Yeah, absolutely. So 2 questions here, the B2C model and how they're being paid or how they get paid or how they pay us, sorry, I should say, and then the employer benefits in the future. So the B2C model, our patients pay membership fees, like you said, and it's scalable. And it's also based on, there are obviously base criteria, and the very basic criteria is the $5 a day. However, if they have more of like a need, then we can scale that up. However, we don't, how do I say this? We minimize it back when we get them to control. So it's not a forever higher need. So let me give you an example to explain the cost basis. Let's say I have someone today that has very complex diabetes case.
Right.
That's a $5 a day. Once I get them to a little bit of control, and usually I do that within about 3 months, then I higher the pay in the beginning to $7 a day. And that's because there's a lot more that I end up doing with them, follow-ups weekly, call them, text them, unlimited text and email all the time. The hours are 2 hours per intake and so forth. Within 3 months, I end up lowering that back to the $5 a day because I get them to a sustainable state. Even if it's not in control, they're sustainable. So then I lower it back to the basic value.
Okay. I'm just thinking from an employer standpoint that this would be valuable, just for employees not taking a ton of time off, going to the ED, or what I mean, or having those situations where they have to leave work or whatever. So that's a huge value.
Yes.
To the
So
employer.
for the employer part, it's a different cost structure because usually that means they have a lot of employees at once. And every company has patients that are super healthy and don't need the service, or patients that really need the service. So then these become different packages, rather than like by day and by person and so forth. The good news about that though is that we always tell our employers that are interested that when I present, I get some people that are interested and I say, if you're, let's say, 25-year-old employee has absolutely 0 problems, but they have a mother or a grandmother that have all the problems that are making them miss work, that cost can be taken for their personal loved one. So it's an employee or a loved one for an employee that would have caused that, absenteeism or like workers' comp or whatever for the employer.
So I have no idea, but the first thing that came to mind was, is ELAK. But they have different, they have a ton of different programs, like side programs, I guess, or I guess I don't know what you call it, but you have your main insurance. But I'm just making ELAK an example because I used to work for the chamber and they gave presentations to us a couple times. But they have like separate. So I guess my question, who's your competition? And that's the first thing I thought of, that could be your competition. I'm not sure how they would do this at all, but I'm just wondering.
Yeah, absolutely.
They have different add-ons. That's what I wanted to say.
Yes, thank you. And you're on the right track. So obviously concierge services are growing. That's why there's a movement for insurance companies to cover concierge services. When we looked at all the competitions, they're broken down into almost buckets. Just to make it into simple terms, there's our bucket, and so far I have only found us in that bucket where we do the B2C, the B2B, and we do the going to the doctor with the patient, which has been a super famous service that we offer for our patients. Then there is the telehealth entities, right? These are entities that don't see the patient at all, zero in-person interaction.
Right.
And they're usually, and they don't have AmCare pharmacists either, which is, the providers I mentioned about earlier in the conversation. So these are run by nurses and by physicians in the background, telehealth companies, but they even have disclaimers in there. If you need a refill, contact your pharmacy. If you need this, contact this. So they're not on like an all-in-one, but they do have telehealth services. And then you have a bucket that's doing a hodgepodge of everything concierge. So they're doing telehealth plus chronic conditions, plus also Botox, plus urgent care, plus everything. They're not focused into like a different or a subgroup of patients. So anything and anyone is okay. And from my feedback from the different patients that we have at ELAK, they ended up choosing us because one, we are a healthcare organization run by healthcare clinicians. And I think that's one thing that this differentiates us from others. And then number two, we have the in-person, like I even have it called on our website, like nostalgic healthcare. It's when we actually go to the patient, to their house if they want to. We see them on video if they don't want to. And we go to the doctor with them and we actually sit with them. And, so there's different factors that make us different from our competitors. So hopefully I was able to categorize our competitors in buckets for you.
No, that makes sense. So do you contract out to your employee? I mean, it can't be all you, right?
Yes, no, yes. God, no.
Yeah, when I email them and when I see them, so I'm like, oh my gosh, okay. So do you contract out for?
Yeah, so currently when the volume gets high, absolutely. The goal, so I will tell you my 5-year goal for ELAK Health is to have an army of practitioners all throughout.
Nice.
So because we are truly bringing nostalgic healthcare back, I want you to feel like you have a provider that comes to you like old school, brings a bag and a thermometer and a Tylenol and like to figure out what's wrong with you. We are obviously not going to have the thermometer and the Tylenol, but we will go. I've been to patients' houses multiple times to talk about what's wrong with, the picture. Usually there's a history of like, let's say IBS. I look at the diet. They show me their fridge and what they eat, everything, like the whole package. And that's why they love paying for it. They don't care because they never get that elsewhere.
Right. Interesting. Yeah, and something like a home health care, like even if it's a nurse, it's not on that level.
Yes, it's a combination of like home health, plus your own provider, plus the clinical advocacy, plus your like, someone that you can call at 7 o'clock at Winco and ask which Robitussin to pick up for your husband.
Right. Yeah, that's the biggest thing.
I have a question.
What did I just say?
What's up, Kent?
Okay, yeah, I'll lower my hand here. Okay, so there's been some procedures where I've had to go in and after the procedure, I needed a ride back. So if someone is going with me, could they provide that ride back to the house?
If we go with you, yes. If we don't go with you, absolutely, like we can't, obviously. But yes, if you're in the geographical area where we are or the providers are, then yes, we actually prefer to do things in person, with whatever that entails. So the other thing, speaking of procedures, one thing that has been super helpful and honestly melts my heart too when I'm the provider involved is that when we are present during the hospital rounds with the patients. Obviously, we're not with the patient for the 3 or 4 days of the hospitalization. But if anyone has landed in the hospital, unfortunately, they know that two things happen. Like one thing happens twice a day. A morning round where you get a group of physicians coming to your room and they're all discussing what's happening and what the plan is and they talk to you and all that. And then another round happens around 7, 8 p.m. And that's when the night shift physicians team come on board and also do the same thing. Those 2 times a day are so crucial for the patient, the family members, and the loved ones in the room to understand what's happening. And a lot of time, there's a huge knowledge and educational gap between the lingo that's being said and the level of understanding that's being retained. And we attend those virtually, just because we can't be in a hospital for hospital compliances. So we actually attend, we put us on the phone or on their iPad and we hear and talk to the physicians that are rounding And then after they leave, we translate and answer all kinds of questions to the patient. With that said, we also ask all the questions for the patients that the patient wouldn't have been able to ask themselves, because you can't know what you don't know.
So with the shortage of physicians and such, are you having a hard time finding people that are contracting with you to provide these services?
From a physician standpoint, I'm not, that's level number 2. Like, we haven't spent, I've kind of just been getting my feet wet on that piece.
Okay.
Because of the the physician shortage, we have a lot of patients that are longing for this kind of care.
Right, right.
Yeah.
I like your logo.
Oh,
Mhm.
thank you.
Mhm.
It's very
I
appealing.
really do. Mhm.
It's every time I came up with it, or every time we thought of ELAK, I put my hands literally just like that, because I like it makes my heart so happy to do something for you, really.
Aw.
And when I talked to the logo designer, he's like, "What do you want?" And I was like, "All I know is that every time I talk about ELAK, like my hands go like this. I want something with the hands, and I want to put my heart on it." So that's literally very personal to me.
Great.
It look cool as like an app icon, just the little logo picture.
Yeah.
Well, Sarah, so you're looking for partners.
I'm sorry, I didn't
Nonprofit.
ask that again.
You're looking for partners or sponsors, correct?
For the underserved populations, yes. So for example, I know there's an African American community in right on the outskirts of the mid Sacramento that are having, for example, a huge event. And one of the things I would love to offer them is that we go and provide screenings for hypertension. I don't know if anyone knows, but African Americans have the highest prevalence of hypertension, and hypertension is the silent killer. So one thing I want to do is absolutely go there and make sure I screen everyone, like save lives. The only thing that's stopping me is like, how much can I do for free versus where can I get sponsorship to have that sustainable model and scale it and grow it. So that's where sponsorships come into play.
Okay.
I've been Googling and asking and connecting and doing all things. So.
Yeah, yeah. Are you looking at increasing your staff too at some point as far as outreach and?
Absolutely, yes. And this is
What's that
definitely
look like?
scalable with all elements entailed, right? So a lot more providers need to come on board, a lot more probably assistants need to come on board for the providers to be supported. So yes, the plan is to grow much bigger. Like I said, I want to have a whole entire army across California for every patient to have a provider at their fingertips, literally in person. So we are all working, my whole entire team is working really hard to get there. Our hearts are in it.
Right.
Nice. One more question, Dr. Millie. What
Yeah.
else could the 1 million cups Chico community do for you?
All right, so I put it back on the screen. Please spread the word, tell people about us.
Yes.
We would love connections, events, communities. Take us where people need us. And I believe me, that's everywhere. And then if you know of anyone or any entity that sponsors events of that sort, in return of obviously whatever they ask for in terms of marketing or advertising or so forth, then we are more than happy to connect with them.
Lovely. Let's give it one more hand for ELAK and Dr. Millie.
Oh, thank you.
It's
All right.
Maybe she can stop sharing. Oh, perfect. There she is.
All right. I'm
The
gonna.
video seems to be
intro.
offline at my end.
There we go. All right. Thanks again to Dr. Millie for her amazing presentation of ELAK. My name is Nicholas Stamper. I am your host and organizer. I would also like to thank Eva Shepard for hosting this event for all of us. Let me thank some of our community sponsors: Chico Start, GrowTech, Global Entrepreneur Network, Build with Ferguson, NorCal SBDC, and Startup Grind. Here are some of our events we got coming up. Again, GrowTech Fest 2023. We say it every week. It is coming up soon, October 11th through 12th. Both 2 days are at the Sierra Nevada Big Room. Is it 10 to 4 or 10 to 7 now?
I can talk about it when you're finished.
Cool. Yeah, early bird tickets are going on until August 31st, so tomorrow. So get in on that while you can. Today from 3 p.m. to 6 p.m. at the Chico State BMU, we are having the local job fair. And then on the 31st, the Inclusivity Project Capital Summit going from 9 a.m. to 1 p.m. in the Greater Sacramento Urban League. Again, you can 1 Million Cups Chico is every Wednesday at 9 a.m. on Zoom or in person here at Chico Start. As well sign up for our newsletter and then visit our website https:/chicostart.com. And I would like to leave us on this quote: the only thing any entrepreneur, salesperson, or anyone in any position can control is their effort. That is from Mark Cuban from Shark Tank and other things. All right. And that'll end it from here. Thank you so much, Dr. Millie.
Sarah, I just wanted to again invite you to Grow Tech Fest. It's a 2-day event at Sierra Nevada. Here in Chico, October 11th and 12th, as Nick mentioned. It is an entrepreneurial conference, so it would probably be a great idea if you came up here. I mean, not that Chico's a completely underserved community, but we definitely have some, Butte County does. So it will be a day of icon startup speakers, industry speakers. There will be investors there, and just probably a great opportunity to network at the event. So I can have Nick send the link to that for you. And as it said on there, we have our early bird prices through tomorrow to 11:59 p.m. So we'd love to see you there.
Thank you about that. And I know I can't do it on the 12th because Sacramento is hosting the small businesses meeting, the government officials.
Oh yeah.
Well, so I will be at the SACPAC, but
Okay.
definitely would love to learn about the 11th and more details.
Yeah, you can pick either day. So we'd love to have you. Perfect.
Lovely. Cool. Well, thank you so much for your time, Dr. Amelia. Like I said, I'm going to go ahead and render this video. It takes a while these days for that to happen, but as soon as it's done, I'm going to upload it and send you a direct link, and we'll be in touch.
Sounds great. Thank you so much. And yes, stay in touch. And thank you all for having me here. I really appreciate it.
Yes. Have a lovely rest of your day.
Thank you so much.